So with that, I'd like to turn now to our final closing session. If I take you back to just yesterday afternoon when we started the conference, we really talked about this idea of how to create a sense of well-being for everyone who calls Virginia home. What are the issues we're facing, and how do communities respond to it? And that arc is completing itself with this conversation this afternoon. This session is about how to create this sense of collective well-being for the residents and the communities in Virginia. So I am delighted to introduce our moderator, and then he will come up and introduce the panel for the session. And this is a man I feel that needs no introduction, but I will anyway. Dr. Bill Hazel is currently the Senior Deputy Executive Director at the Claude Moore Charitable Foundation. The foundation funds projects related to health workforce and healthcare workforce throughout the Commonwealth, and focuses, in addition, in particular, on health and human services in Loudoun County, Virginia, and Northern Virginia. You all know Dr. Hazel for many years when he served as the Secretary of Health and Human Services under 2 different governors. And after that served as a senior advisor for innovation and community engagement at George Mason University. We are delighted to have Bill in the panel here today, and particularly thankful that Claude Moore Charitable Foundation is the financial sponsor for this final session. So with that, let me invite Bill to the stage to say a few words and to get us kicked off. Thank you so much, Bill.
Thank you, Robin. The good news here is we have a great panel, so you won't have to listen to me talk very long. So yesterday we started off and we heard well-being, and we got the good news about our future from California. I realized when he said that 2.5 million people have left California in the last couple of years, California might be coming east, so be prepared. But and we heard last night, Mary Fant talked a little bit about what we do, and it's, are we bricklayers? Are we putting the bricks in place? Or do we have a vision of the cathedral? And there's this top-down, bottom-up approach to things, but it all comes back to, you know, what is it that we're trying to achieve individually, in our foundations, in our philanthropy, in our communities, and together here at this network. And this theme of well-being keeps coming up. And I can recall hearing about it early in my tenure as secretary, and you know, I'm a data-driven guy, data-informed guy, and all these pieces, and you hear it here. I mean, how do you decide what to do when there's so much to do? And then what happens when the things that we can measure don't seem to be telling the story? As in this country right now with the mental health crisis and the issues that we're having, the numbers aren't as bad as we seem to feel about it. And I was at a meeting in DC, I don't know, probably 2014 or 15, and a group of us went to Gallup, and the Gallup organization polls around the world every night at 6 o'clock. And they had collected all of this data, and they had this thing called an index of well-being. And they said, you know, if we'd have known to look for this, we could have predicted Arab Spring country by country based on this metric. Imagine that, you know, now the retrospectoscope is generally 20/20. If it's not, Clark can get your glasses fixed. But think about that. They had a metric that seemed 2 months or so in advance to be able to predict when these governments were going to fall in the northern Arab region. And so you go back and you're a member of an administration and you say, gee, your governor, what does the governor want at the end of the day for the Commonwealth? Think about that. So what do you want as individuals, as foundations for your community? What does your mayor want, or your board of supervisors? And if we think about in that context, what is it? And if we do our thing in philanthropy, how would we know if we're successful? How would we know? Early on, because some results take time coming out. So there's this concept of well-being. So we have a panel of people who've thought a lot about well-being, and we talked for about an hour this morning, and I think hearing from them will be really provocative. But what we'll do is we'll come back and like you to engage in the conversation. This will be a group conversation at the end and then a wrap-up by 2. So I'd like to invite our panel up. We have Claire Gibbons. Dr. Gibbons is a Senior Program Officer for Research, Evaluation, and Learning at Robert Wood Johnson Foundation. I don't hold it against her that she used to be at Chapel Hill, given that I'm a Duke graduate. Dr. Anita Chandra is a Vice President Director of RAND's Social and Economic Wellbeing and is a Senior Policy Researcher at the RAND Corporation. And she had the good sense to live in Durham when she was younger. Thank you. And then we have Tony Rosansky. Tony is a Senior Director at Casey Family Programs, who has more recently come to work with the team in Virginia on child and family well-being and child welfare. And she previously worked in Eagle County, Colorado, and the County of Denver's Human Service Agency. And she says that Californians have been going to Denver, too. So you all can laugh at that. I mean, it may have been a bad taste, but you're allowed. It's the best I can do today. But anyway, with that, we'd like these ladies to introduce themselves, talk a little bit about what they do, and then I'm going to ask them really think about what is well-being as they see it, and how do they define it and measure it, and we'll go from there. So why don't you start, Anita?
Well, thanks, Bill. I haven't had the heart to tell Bill that I grew up in Durham and I was born at Duke University Hospital, but I'm a Tar Heel basketball fan, so.
Can we change the panel? Who set this up?
Yeah. So it runs deep, right? Tar Heel, but Carolina pride and Virginia pride. I live in Northern Virginia and proud to be part of the state. So at the RAND Corporation, as Bill nicely shared, I'm vice president of one of our divisions. And that division actually is called Social and Economic Wellbeing because I think we understood that so many of the policy questions that we are facing today and into the future really sit at that intersection of where well-being sits. It sits at the intersection of policy choices that we're making between health and education, or health and the economy, or the environment and education. And yet our policies are siloed off from each other. Our programs are siloed off from each other. The way that we invest in communities are siloed off from each other. So I've had the privilege, both in that capacity, but also as a well-being researcher, to work with cities and communities, work with mayors, like Bill referenced, work at the state level to think about what does it mean to create a well-being investment strategy, and I know we'll get into that a little bit in today's discussion, but it's great to be with you.
Okay, Claire.
Is this on? Yeah. Hi, everyone. Great to see you. Thanks for staying. Great to be at a more local conference where we can all drive home. That's really fun. I live in Northern Virginia, too, in Herndon.
I don't think they think of Northern Virginia as Virginia, a lot of these people.
Well, I pay taxes to Virginia, so that's how I think about it.
And you all were complaining yesterday that they were not paying enough tax, I believe, we were told. So anyway, go ahead.
I'm a senior program officer at the Robert Wood Johnson Foundation, and I work officially in the Research, Evaluation, and Learning Unit. So I work with Anita closely on our well-being work that is maybe fledgling and growing. Just so you know, the Robert Wood Johnson Foundation, our North Star is achieving a culture of health, which is what we say is where everyone in America has a fair and just opportunity to have a healthy life. And in our formal documents, we always say to have health and well-being. So well-being is also there in our North Star language. And I'll just say we also focus a lot on these days on disrupting our structural challenges and structural barriers to health, including structural racism. So RWJF has a history of moving upstream in our work. So we're getting more and more focused on root causes of some of the fundamental problems that we face in our society. So we used to do a lot of maybe traditional public health programming, and I'd say we moved upstream to focus on social determinants. And now I see us sort of focusing again one more step higher up on the root cause analysis frame, thinking about these kinds of structural barriers and taking our history and history of policymaking into account. And that's what kind of gets us to thinking about well-being. So we'll talk a little bit more about what we're doing and learning there next.
Thank you. Tony.
Good afternoon, everyone. Tony Rosansky from Casey Family Programs. And Casey is a national foundation working ultimately to end the need for foster care. But a few years ago, when Family First Prevention and Services Act passed, Casey, in support of child welfare jurisdictions, began moving upstream, sort of the dream state of supporting kids and families differently. And so as we think about community pathways, safe children, supportive communities, we think of all of the opportunities of partnerships in communities. And so while Bill mentioned I live in Colorado, I am new to serving in the capacity of senior director and consultant here in Virginia. And my portfolio includes Virginia and West Virginia, and then Wisconsin and Ventura County in California. So I have a
Who dreamt that up?
I know, it doesn't make a lot of sense, but I get to hit all of the time zones with where I live. So really happy to be with you all and really excited to have this conversation about the responsibility of all of us in moving to support our kids and families differently by well-being.
So we're all interested in well-being, but what is it, Tony?
You know, from my perspective, well-being is safe, happy, healthy children, adults in a community where we all have what we need to thrive. And that is something different for all of us, I think.
Claire?
Yeah, I mean, we can look at the definitions and they're a lot like what Tony just said, which is kind of every dimension you can think of, like wellness or happiness or success in those areas. The way that I think about differentiating well-being from kind of health and health outcomes work is a very critical component, which is self-reported information. So how are you thinking about your own life? There are a number of different types of questions, different well-established response categories, but essentially it's inviting people in to tell us, how are you doing? What are your values? What do you care about? And where should be working for you, rather than looking at rates of diabetes, rates of cardiovascular disease, really asking people what's meaningful for you and what are you values.
Anita, tell us from Rand, the real answer.
Well, I wouldn't be Rand if I didn't think in terms of sort of systems and policies, and so I totally agree with where Tony and Claire are going, but I would sort of bring it home a little bit more. When we're talking about community well-being, we're talking about the investments in systems and structures that work in a coordinated way to promote thriving and flourishing. And so the kind of the sum is greater than the component parts when we're talking about well-being. The policies and the investment structures are very different because they are working in concert with each other to promote and to create the kinds of amenities and promoting resources in a community that help people not only thrive and flourish, but get to the ultimate outcome of well-being, which are these three words that are important to keep in mind: a sense of purpose, dignity, and connection. And some of that is individually born, but a lot of that is collectively born in communities, how we take care of each other and how we relate to our institutions. And so, to Claire's great point, this is what differentiates, people who do health work or education work or environmental work, all critically important. But it's the interconnection of those things that gives rise to community well-being.
So it's hard enough to keep track. As secretary, have all these programs again, and we want evidence, we want data, and so tell us how you would know whether your community was being successful in reaching this well-being as you define it. We'll start with Rand.
Yeah, we always start with Rand on the research. So a couple of things to keep in mind if you're not aware of the kind of well-being data. So most of the work that's happened in well-being, although there's a growing body of work in community well-being, is around individual well-being, subjective well-being. And we know that as people move up...
We data people don't like subjective.
I know, but it is important to ask people how they feel.
Pardon me, I told them to think of Pardon the Interruption. You all have seen that show on TV. We figured it would take me to keep this awake.
We're going to make this ESPN. So. Yeah. Although we'd have to fight on basketball probably, right, Bill? But
we've already started.
Yeah, already started. So the thing to keep in mind is that if you change people's response on a simple life satisfaction scale, those scales are usually 1 to 10. People say, how are you satisfied with your life today? Even a move from, let's say, 7 to 8 is related to a change in economic productivity. We've proven that in other countries, and we know that in the US, and yet we don't really ask people how satisfied they are with their life. Another example, Bill mentioned the Gallup poll in terms of monitoring and predicting what was Arab Spring. The same is true if we had asked people about life satisfaction, hope, and optimism before the opioid crisis or the rising mental health crisis, the so-called diseases of despair. If we had asked people about some of those basic tenets of subjective well-being, we would not have been so flat-footed in terms of our response. And so again, the subjective and the quote-unquote objective parts of well-being have to go hand in glove. We know that investments in community kind of amenities that help people thrive and flourish, whether it's investments in libraries and community centers and green spaces, also matter for people's sense of safety and sense of place. And so you put those pieces together and you say, are we tracking the right things? The governor example that Bill mentioned, what would give the governor a better pulse on the state of play? That actually matters for the economy of Virginia. The research continues to grow, but it's pretty clear that we need to capture these things that, before have been kind of seen as fuzzy, to your point, but are actually absolutely rigorous and important for our future as a country.
Now Claire will tell you what you should have said.
Well, I'm just going to add, I was looking at a paper that was published recently using data. So the Western Europe is further ahead in terms of their population level measures of subjective well-being, which is a term that I'm coming to loathe because I was actually trained as a health services researcher, so very, 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 very data-driven. And we all actually, I think culturally for some reason, we're very snobbish when it comes to people's self-reported information. When people self-report their physical health, they do a great job. And when you ask them how they're doing, they do a great job telling you on a scale of 0 to 10, how are they doing? And it's actually established that we have information from a population of 700,000 people in Western Europe that demonstrates that predictive ability, the ability of subjective information from one question on a 0 to 10 scale, how are you doing right now, in a couple different areas, that actually has a stronger predictive value about whether someone's going to make a change related to their job, related to their relationship or marriage, related to their, where they live, that predicts those life decisions a little bit better than sociodemographic data and other information that economists and others typically use to predict what people are going to do. So the evidence is pretty clear that this is meaningful information. People are logical in their thinking, that it's a linear relationship between action and what people are thinking and what their values are. So I think we still have a ways to go on establishing that, and not all of us automatically, because I kind of do it too, and I work with very serious health researchers who just automatically roll their eyes, and I think we need to move to the point where we don't do that anymore, because it belies our value that we know more than people in the community. We know better than people about their own lives. We know what they should do. We know what should change to make their lives better. And that is something that RWJF, and I think broadly, we're coming to understand is not an appropriate perspective, and that we really need to ask people what their values are and take action based on that. Let me look. I was taking notes. I want to see if there's...
I thought you were texting.
No, I'm not texting. I can't remember anything.
Robin says y'all are welcome to tweet out, hashtag VFN or what is it?
And I think well-being allows us to do that work of community engagement in a real way. And I think you all are probably doing that really well, and RWJF is a national foundation, so it's a little bit, this is something that we're still learning how to do better. But that's one of the things that well-being does for us, is allow us to really focus on community and understand their values.
So Tony, go, you're next.
I was just going to add a little bit to that I think the answer to the question is in your community. The people have the answer. We should be asking them. We should be informing what we do about the work around well-being by the answers that they provide. And so those voices of lived experience or lived expertise, I think, is one of the most valuable pieces of the puzzle when it comes to thinking about measures and learning from those closest to the work. The answers are typically in those closest to whatever we're trying to solve. And in my mind, that's people's hearts and minds.
It's interesting because we heard yesterday the community engagement piece from California. We heard last night about that, or I forget when this morning, I've lost track, on the from Alexandria about the bringing people together in that community around. So that all makes sense. As we talked this morning, there are a couple things that sort of came up in this discussion, and one is how your prism. Anita, you talked about a prism to view, a well-being prism to look at our work, as both as government and as philanthropy. What is a well-being prism?
So, and I've done some of this work with cities and communities when they're trying to kind of reorient government, but also working with nonprofit organizations, philanthropy, and the like. And one of those communities that we worked with wanted to transform essentially the purpose of government beyond just filling the potholes and making sure that people's permits got filed accordingly, all critically important. And they said, the purpose of government in partnership with philanthropy and nonprofit organization should be about unleashing human potential. And they made a very strong economic argument, which was if we're going to compete not only as a country internally but externally, we have to be at a place that we can not only unleash that potential, but we can be innovative and creative. Well, how in the world are you going to be innovative and creative in a mental health crisis? How are you going to be innovative and creative in communities that don't engender and foster and promote absolute thriving, or can be resilient to disasters or climate change or what have you? And so the idea of the sort of well-being prism or lens was to look at everything that that government was doing along with others and said, what are we measuring? What we measure is what we value. Are we measuring the right things that is going to tell us anything about the hope and optimism of this community, the investments and assets, the ability to get to that human potential? Where are we putting our money? Where should we be divesting in some areas in order to collectively work to an idea that's going to get to that notion of purpose, dignity, and connection? And so it was very much tied to the idea, not just of the sort of humanitarian elements, which are absolutely critical. It was a dollars and cents argument. It was sort of an American kind of future conversation. And the question I would sort of put to all of you as philanthropy at the community and the family foundation level is, what part of your investment strategy is sort of contributing to that vision? Bill mentioned we are moving along building the bricks, but what are we building in terms of the building or the cathedral? Are we putting the pieces in place that are preparing our children for the second half of the 21st century? The ability for those children to have purpose, dignity, and connection, the ability to really have the assets to not only survive but thrive is essential. In today's world, the ability for us to understand how institutions are working with each other, all of that is kind of the well-being lens. And then all of a sudden, when you have that vision, you change what you measure, you change where you put your money, you change how you work across agencies, across philanthropies. All of a sudden, you're thinking about the systemic changes in a coordinated way. And it doesn't mean additive. It means thinking, shifting that lens completely to that orientation.
Claire, your thoughts?
Yeah, I think, if we think about where we're at right now, what drives most of what we do is our economy. And we have a false narrative that if our economy is doing really well, then our communities are doing really well and our population is doing really well. And I'm not going to go down the whole list. I think you guys maybe had some sessions that talked about where are we right now, and it's pretty easy to get pretty sad when you look at the disparities and inequities we have in this country, and some of the not progress that we've made. And it's disappointing. And I think part of that is because we've just hitched ourselves to this idea that a growing economy, a good GDP, whatever that means, that is what brings us satisfaction and success and health. And it's not true, right? Like I think we're realizing that. And when I listen to the news and I hear the focus on the economic situation in the United States, it's so apparent that it's completely separate from how well or not well people are doing. And so those values in the prism that Anita was talking about, that is what should be driving the work that we're doing, rather than sticking kids through some sort of like automatic education system so that they have a good job, because then they're going to be happy. And we need to realign our measures of success with what our kind of fundamental values are. And of course, having a job, having your needs met, having the finances that you need. I don't think any of us are saying like those things are not important, but we're saying that is not the only thing that's important. And to many of us, that may not be the most important thing in our lives.
So it's interesting. I'm going to get to you, Tony, but we've heard that maybe the economy by itself isn't the most important thing. Earlier when we were talking, we were questioning whether it's the highest degree you attain in education, may or may not.
I work with a lot of economists.
Well, that's a different problem, So the question then is the things we tend to look at are things that we look back to. So you always say generals fight the last war. And so I'm going to come back to you, Claire, after Tony speaks. But the question I'm going to ask you specifically is, as we look at a world realistically with a squaring of the population, meaning our birth rates are down, people are getting older. So instead of this pyramid, we now have a squaring of the population. And yet our economy in the way we think about things is growth, 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 growth. So how do we think about what we're going to do or what we should be doing in the future when that growth may not be as evident, particularly if we're not bringing people in from outside? So I want you to get to that when you come back. But Tony, you owe us
Just real quick, I was just going to add, it feels like to me when we think of the prism as safety and success of every adult. And so as we think about that, maybe the prism from my perspective is creating a community of hope. If we're left with the feeling, then the data will follow.
hope. Let's hang on to that word a little bit too. Claire.
Okay, well, a couple caveats. I'm not an economist.
You just heard applause for that concept out there. Are there any economists in the room we're offending?
People too.
There are people too.
I have feelings.
Yes, economists are important, but I am not one, so I can't speak for them. I think there are a couple things to raise here, though. One is just on that growth point. I think maybe we're starting to not grow, except if you think about this from a racial equity perspective, a lot of people in this country have been left out of the economy and have not had the opportunity to participate completely fully. So I think there's actually a tremendous amount of untapped growth that can happen. And we're starting to talk about that more, and we're starting to figure out ways to do that. So I don't know if that growth perspective is actually, if we're kind of stuck in that box.
Can I add to that?
Yeah, Anita wants to get in here. Rand has the answer.
We try. So, the way to, first of all, I think COVID gives us a great example of the fact that we didn't employ a well-being prism or a well-being lens. And these folks have heard me say this, but if we had been thinking in a well-being framework, we would not
Instead of a health framework.
Correct. We would not have pitted health officials against those who cared about the economy. That's a false dichotomy, and I think everybody understands that today. But shame on all of us in public health, and I can say that because I'm public health, shame on our economists and those for exacerbating that tension, because that is not the narrative that we need going forward. That's one. Two, when we think about growth, we should think about it in the context of what a business would think about, strategic growth. Well, strategic growth means a very different way of thinking about pathways to success and creativity and innovation and productivity. And so we don't have to abandon the principles of GDP and the economy. It's just that it can't be the stand-in for everything. I bored them earlier with sort of a reminder that if you look at the Greek derivation of economy, it means the management of the household. Well, why did we think that the management of the household was just monetary? All of you are running households. You could argue that the house is on fire, the home is on fire right now as a result of some of the things that are happening in our country. So if we return to that idea of home, then we don't have to actually set the economy to the side, but we have to ensure that it's not all of the pie, in the sense of the way that we operationalize it today. And I think those are important things to keep kind of front of mind as you're thinking about your grant making and your philanthropy. How do those pieces come together? Access to economic opportunity is a critical dimension of well-being, but so is community health and place. And so those things have to be thought of together in terms of our investment.
Tony, you pass?
Nothing really to add.
So Anita makes the comment here that we may have overemphasized the health angle in some circles versus the economic angle. And RWJ thinks about social determinants of health. And I've always thought that sort of undersells it because people don't always understand or believe that, but they do believe in social determinants of life. And now we hear social determinants of well-being. So I would ask RWJ for an official position. The lady from the Federal Reserve yesterday started off with the disclaimer that sort of the opinions of this person don't represent the Fed, so don't quote me. But anyway, your thoughts. She's speechless.
Yeah, I'm thinking, caveat, I don't speak for the Robert Wood Johnson Foundation, I'm just an employee. I think that term health has, the problem with the term health is that people often, all of us often hear health care and we think about what happens in health care settings, and obviously that's critically important, especially when you get sick. But that is not where health primarily is produced. It's produced where we live and where we work and where we play. So the social determinants are simply a
I think you got
recognition.
applause there someplace. Who is applauding back there?
There you go, okay. So social determinants, it's just a way to say that what makes you healthy or not healthy has a lot more to do with where you spend your time than it does with just the healthcare system or just the doctor.
And how does that translate to well-being, since that was the topic that Robin assigned us?
I think well-being is one step up in terms of root cause. And I think that it aligns really well still with RWJF's focus on achieving a culture of health, because I really think that cultural shift is what we need. It really is that fundamental, and it's about how do we think about ourselves as Americans. It's how do we talk about ourselves as Americans? There's some really nice examples of small communities, and especially see this in indigenous communities in the United States, where they have that strong sense of these are our primary values. And, there are examples of, for example, community members getting together and saying, our schools aren't really doing what we want right now. And going through a
Does anybody
process
have that problem? Besides Loudon?
Ford in Virginia, no.
Of going through a process, what are our values? What do we want our children to know and be capable of doing by the time they reach age 18? And then restructuring schools accordingly. And to me, that is really inspiring.
So go ahead. I'm going to prep the next question, Tony, and then you respond. But the next question is going to lead into this issue we were talking about earlier, the social contract that binds us all. But Tony, go ahead and seg.
Yes, I was going to tie this conversation a little bit to our earlier conversation around basic needs and the strength of communities and how we think about tending to each other. And in our earlier conversation, we were just talking about the hierarchy of needs. It's a foundation, but it doesn't completely hit the mark. And I hadn't thought about it that way until we were talking, where, yes, we do need housing. We need all of the insecurities sort of taken care of from a community setting. But then the connectedness part is such an important part of those basic needs as well. And so it's how do we think about that component a little bit differently?
Thank you. And I know Anita's going to want to chime in here.
Oh, on social contract?
Yeah,
and the rest,
social contracts in here.
Yeah, I mean, one of the things that we often shy away from in a lot of kind of the sector-specific work is talking about what Claire and Tony were mentioning, which is to really think about kind of the culture and the values and the narrative of our communities, right? The story of our communities, the story of our country. And we're long overdue, right, for a revisiting of what the American social contract is. What should we expect from our institutions, including but not exclusively the government? What should we be expecting from our neighbor and from each other? What does that actually look like in 2023 and beyond is a part of this conversation about well-being, because the choices that you're making to invest in all the things that get you to purpose and connection and dignity and hope actually is inextricably tied up with all of those choices that we're making in terms of our expectations around what is owed and what is required. And so this is where I think it's really kind of exciting, actually, because there is more energy behind the well-being conversation. It's lifting up all those things that many of you are very aware of that impedes like implementation of good programs in communities. People sort of said, it was an evidence-based program, it looked pretty good, we rolled it out, and then, it didn't work. Why didn't it work? Well, we didn't really understand the culture and the narrative and the story of that community. We didn't actually understand what the expectation was around the covenant or the social contract that people had about institutions and about each other. And so as we think about, in your position, your investments, the role of philanthropy to catalyze change, the grant making, how are you contributing to that part of the conversation is as much as important as the individual bricks in some of your programming, right? It's the glue between the bricks, or the, the cement, if you will, in terms of building that institution. And that conversation is happening in pockets, but the question, I think, for all of us is, how are we having that conversation collectively?
I think in the space of building these communities of hope, it's going to take more than any one sector like you're talking about. And I think the inclusion of government at the table and nonprofits and the philanthropy and the people who have that lived expertise with maybe our faith-based leaders, it really is like, how do we strip away the competition and all create this new lens that we were talking about earlier? And I think that's also one of the responsibilities of philanthropy, is often that you can set the table for those exact conversations and help influence people's thinking by bringing all of the people together, rather than, if we remain in all of our silos, we will remain holding this problem in place exactly how we have been holding this problem in place over time.
Just so you'll know that in Virginia, we refer to those as cylinders of excellence. They're not silos.
I'll work on my nomenclature.
Thank you. Maybe Colorado has silos, but we're much more sophisticated. Claire, were you going to add?
I just, want to interject some additional humility into this conversation, which is, RWJF started thinking about well-being primarily from our work through we have a small team called Global Ideas for U.S. Solutions. So even though RWJF only does domestic work, we have a small team that looks at the globe in an act of, again, trying to have some humility about ourselves and the United States to say there's a lot of great work going on outside our borders. Good ideas have no borders. So what can we see that's going on in the globe that we might be able to bring back to the U.S. and implement? And not just implement, but learn from and think about. And one of the things that came up was well-being. We could see that there were a lot of countries that were implementing national well-being surveys and then actually talking about well-being budgets. And it was New Zealand and Canada and the UK and Wales and Scotland are doing great work, Bhutan, probably other places as well. And so we started thinking that maybe there's something there for us to do in the United States. And so we've done a couple years of learning globally, and now, and we've done some investigating around narrative, done some thinking around budgets, and now we're at the point where we want to do more implementation or thinking with communities. But that's the point we're at. We're not coming saying like, oh, and we have these 16 programs, and here's what we've done, and here's what we've learned. We're nowhere near that point yet. And I know in my own mind, I'm still struggling a lot with, okay, how is this different than social determinants work? What sets well-being apart? How can we talk about this with other people? Well-being is a term that is quickly changed to wellness and yoga and elite white people things, and that's not at all what we're talking about, but people just hear something different sometimes, and there may be quite a bit of work that's focused on well-being in the United States, but people are not calling it well-being, and so it's a little bit challenging to figure out what is going on out there. Are there people we could fund to do this work in the communities? What would that look like? How fundamental are we going to go? Is this just thinking work and design work to begin with? So this is kind of where RWJF is. In fact, we wanted to make grants in communities to do the work and then spent about a year looking around and thinking, we're not really finding the right person to help us administer that work or knowing exactly what to say to the communities. So instead, we're going to spend about 18 to 24 months doing a lot of I don't even know exactly what to call it, but capacity building, inviting people in, meeting with people from different sectors to bring them into the work, to see where is their momentum, and to see what are people's ideas, again, across sectors, across communities. And I will say, my guess is that the well-being economy discussion is going to be a really important hook, because that is something that seems to be gaining a lot of traction in cities.
I hear a hint here, gang. Do you hear that? They're looking for places that are going to pursue this, and they might bring money. RWJ brings money. They bring money, which is good. So be thinking about that. I want to go back to the story discussion in the narrative. And I shared with the group earlier, and even members here, as you go around, if I hear the word equity one more time, I'm going to scream. I'm touching the third rail, but I think we have to talk about it. There's a sense that this is a zero-sum game is the problem, I think. And we were discussing a little bit, but I'd like to get your take on it, because I mentioned earlier this morning that in the government world, truly everything does create winners and losers. So we've set up a dynamic where for someone else to win, someone has to lose. And let's talk about that a little bit, because and how thinking about it as well-being may change the discussion.
Yeah, we've gotten ourselves into a bind on all sorts of binaries, right? I mentioned the one through COVID in terms of health versus the economy, the binaries on where the conversation on equity is currently sitting. But unfortunately, if you're really being thoughtful about the conversation about equity, you're really just talking about access to opportunity, justice, and fairness, which is quintessentially, should be an American value, but we've fallen down in a lot of
part of the
important
social
ways.
contract, you would
Part
say.
of the social contract. And we have to be honest about the histories of communities, the structures, and the systems. But Heather McGhee, if many of you are familiar with Heather McGhee's work, talks a lot about the solidarity dividend in her book, The Sum of Us, and gives the example, many of you are nodding your heads. I'm from the South, so these conversations resonate, where in order to kind of maintain segregation, they close the public pool. Well, who lost in that, right? Wasn't just the black residents, also the white residents, right? And that's a very simple example. Where are the places where we're working in contract with each other, where we can create solidarity around all the things that we know give people access to the opportunity to lead dignified lives? That doesn't mean taking away from you in order to give to me. And we have to sort of reject that kind of policy conversation, that we have to reject that community narrative conversation. And even if you're not moved by sort of a sense of the ethical and the humanitarian and idealistic elements of the equity conversation, can be moved by the monetary and financial aspects of the equity conversation. Quite simply, the economics around not thinking in a zero-sum game and thinking in a solidarity dividend has tremendous impacts on the economic productivity of a country. And so there are many kind of levers to pull in this conversation, and we got to get out of this sort of this narrative that, you know, is killing us in more ways than one. I mean, I was in a meeting a few months ago to kind of celebrate the anniversary of these two landmark health reports. And it was a sobering conversation because not only is there nothing to celebrate, in fact, we have a life expectancy that is not just stagnating, but declining. And initially it was declining for white middle-aged men because of the opioid crisis and substance use. It's now bled over to black men because of fentanyl. So again, we're all in this like ship together on, if we can't live past a certain age on our watch, quite frankly, how in the heck are we going to be sort of a vibrant nation? So that's the way to start kind of talking about it. And I know we're far from that because of our internal fractures as a country, but I think there's a way that we can start to lead with new language.
Tony?
Yes, I was just going to add, thinking about Casey's work with ABFE, one of your member organizations.
Ed represents them, I believe, who was
That's
here this
right.
morning. Back in the back.
There he is.
Yeah,
Well, he'll be proud that I'm going to mention this, but as we did some of our discovery, we've been thinking about what do we do about this? And so as we have been using one of the tools, which is really digging into the data more, really getting down to neighborhoods and geocodes for those data wonks out there, and then having a targeted universalism response to that, where it doesn't have to be everyone gets everything, but really getting to very specific places where you can make a difference with a response. And so I've been thinking more and more, one of the places where this is happening in my work is in Milwaukee. There are very specific neighborhoods where the black and brown boys are hitting the front door of the child welfare system. Once they hit the front door, they have an investigation, have a finding, they enter the foster care system, and 71% of them end up leaving foster care with no connections into independent living. And so the trajectory of those kids' lives is just drastic. What can and should we be doing different about that? And just as a very specific and targeted approach, we are working with law enforcement in precincts with actual officers to help them understand what are the laws that require a call to a child welfare hotline, how the hotline works, and the personal bias that exists there in the information that's gathered and what they do about it. And then from a case management standpoint, how you can connect kids with families so that the trajectory changes. They don't have to get to those highest levels of care. They can reside with family in some cases. And how do we support in a different way what that could look like in, not from a savior mentality, but more from that our kids deserve something better. And we can see by the story in the rearview mirror, like you were saying earlier, Bill, it's always really clear.
Yeah.
But we have to do something about the future.
Yeah. Claire?
Yeah, I mean, I don't know if I agree with Anita. I think I might be disagreeing. And I think I understand where you're coming from, Bill. But
I'm not sure I do.
we
is the
have
problem.
we cannot leave the equity conversation behind. We cannot. I mean, I don't know why you guys go to work every day, but in public health, it's to make sure that we have a better and more just society. And when you see these fundamental differences in people's opportunities and ability to live a healthy life, that's why you work at a philanthropy, I think. So let me know if that's not why you guys go to work every day, but that's why I do. And I think we've had such false narratives for such a long time that we're still really struggling to understand why do these inequities exist. And the reality is that public health especially has been very ahistorical. And so I've had to relearn, unlearn, and learn a lot in the last 5 to 10 years. And I went to school for a really long time. And I just wasn't smart enough to ask the right questions and accepted what I was taught about poverty is the reason, intergenerational poverty is the reason that we see these inequities. Well, okay, why is there intergenerational poverty among Black communities and brown communities at a completely different rate than among white communities? And that's because of explicit racial bias in our federal policy that has existed for 400 years. So that's not, and I think we have to separate the conversation in a better way, because I'm white, like super white. All my ancestors are from Western Europe. So I don't have lived experience in this way. But a lot of my family was poor. And my father did not have a college degree. And he got laid off in his mid-50s. And that was not great, right? And so it's not saying that white people's lives have been easy and that white people have individually all had this amazing government handout that makes their lives like charmed. And so white people get over. So we have to kind of separate that individual experience of people and not make assumptions about their lived experience based on their race, but understand as philanthropy, we focus on policies and systems, and we have not adequately made amends for explicit federal and state policies that have caused this tremendous harm. So I think we have to keep pushing on equity. I think it's really hard. It's really personal. You have to, work on this professionally and at the same time personally. It's very, very challenging, but really important.
And I want to make sure I'm clear about what I'm worried about in the discourse is, and we're sort of 3 years post George Floyd's murder, fractures in the conversation that are going to continue to disproportionately impact the communities most in need. And so why I'm saying let's not be scared of the equity conversation is let's remember, like it's a core principle actually, always has been of public policy and public administration. So it's a false conversation that's happening right now to be scared of equity. Because if you actually look at the roots of sort of US democracy, or if you go into other countries even before that, equity was central. What's different today is people are having a deep conversation about a racial demography that's changing, and we can't shy away from that.
No, we can't.
At all. And the worry is, how are we going to sort of practically move into structures and policies? And I think we agree on this. As opposed to talking about it, definitely the interpersonal piece of racism is important, but I got to be honest, I'm more interested in the systemic pieces. Quite frankly, because who loses in this and so that I think to the sort of the conversation I think that Bill is sort of lifting up in terms of the DEI conversation is the risk that it goes away for all the wrong reasons because of a discomfort and a misplacement of the equity piece of the DEI piece. Pull out equity from DEI, pull it out from DEI, X plus whatever, not because those things aren't connected, but the worry right now is an incredible backslide in the policy arena, and that concerns me at the community level because people will find ways to diminish it in the conversation. And that's why well-being excites me, because if you take a systemic lens to it, then it moves beyond just sort of investments in individual wellness or mental health, albeit critical. So I think, I mean, I really appreciate what you're saying.
We
but
finally got to pardon the interruption.
Well, no, but I'm being practical about it because, you know, as a personal color on this panel, like, quite frankly, I see the daylight happen in the conversation, and all of a sudden we stop talking about equity out of a little discomfort. So that's why I'm sort of trying to find the narrative that we can grab onto, because who loses if we don't?
So this is a tender spot as we go forward. And it's not to, you know, my bringing it up is to have this conversation and say we need to have this conversation because there is pushback on a lot of the things that are said, and words have meaning that different to different people. And I think we have to, maybe the narrative has to change a little bit. And like when we go from health to well-being or some of these other things, we may need to think about the words that we use so that we don't inflame and we bring down. But anyway, that being said, have we stimulated the audience to make any statements or have any questions? I know Kelly was taking notes, and I didn't know whether she was teeing up questions or writing a speech. But anybody? Yeah, John? Yeah. Why don't you bring him a microphone? Who's got?
I've been told I can project, but I'll wait for a microphone.
Oh, you can, yeah.
Here she comes.
This hopefully encapsulates some of what Bill led with and what some of our panelists have referred to. In a resource or growth constrained America, Virginia, in the coming years, one of the issues we're going to face is how do we advance, how do we improve our communities, both economic well-being, which contributes, I think everyone would agree, to the physical and life well-being. In a life that involved local government management and philanthropy, I've sort of come to the conclusion that there are three broad communities that affect how a community changes. It's government, it's nonprofit or philanthropic investment, and it's the business community. Governments are largely agents of the status quo at the state, federal, and local level. They're acting to keep things the way they are because that's who is elected to do that job. The philanthropic investment and nonprofit communities are largely agents of change because they want to improve things and make them better, which is sometimes scary to the first group. And I found the most traction in getting that change made is by involving the third leg, the business community. Because if you can get the business community saying, this is an important thing we need to do for our community, government's far more likely to pay attention. If you get all three of those mules harnessed to the same, and Bill, don't go one generation up on the equine level in one description there, but 3 mules, not 3 asses, but 3 mules connected to the same plow, pulling in the same direction, you're far likely to get more traction. And I'm just wondering if you agree, if you disagree, if you think there's an opportunity there for philanthropy expanding its reach and influence. Discuss.
Have at it, ladies. Tony, you got something?
Well, I mean, I'll say that I'm glad that you're raising the business community because they've actually been part of the well-being conversations in some of the communities in which I've worked and had the privilege of working. I mean, so there's a couple of things that are going for us in this conversation with the business community. One is a conversation that's sort of revisiting a more purposeful capitalism. I mean, people can debate this, and that's a whole nother probably session, but you know, the idea of stakeholder capitalism that's taken root in the Business Roundtable, whether you're Jamie Dimon from JP Morgan Chase or you're a local company. So there is, this conversation is sort of happening in kind of the next generation of corporate social responsibility and community benefit. The second thing that's sort of going for us in the well-being conversation, oddly, right, is the pandemic, in the sense that people's conversations about employee quality of life, expectations, particularly of this generation, to live, you know, a certain kind of life that might be different than, you know, more tenured folks. That has opened up a conversation about well-being amongst kind of employees and organizational commitment to well-being. And for a lot of CEOs, they understand the ideas around productivity, presenteeism, which is a problem, the mental health costs that they're paying, and this idea of innovation and creativity that we talked about a little bit earlier. So there's some things that are going well. Now, sometimes it's an uncomfortable, to your point, relationship, because we're talking about sort of issues of structural inequity, maybe we're talking about disinvestment and reinvestment. But there's an opportunity here with business that has only grown, and then you had the conversation with the Fed the other day, right? Yesterday, the Federal Reserve is playing a big part of this conversation, and also through community development financial institutions. The current Department of Commerce and Treasury at the federal level has started to embrace more of a well-being kind of framework to their economic development work. So there are a couple things going for us.
That gets you, John?
Sure, thank you.
Questions, comments? Kelly, are you getting ready? The glasses came off.
She's getting serious. Ladies, amazing.
I see her.
I'm just so delighted that you are speaking.
Can we bring her a mic, please?
Power. Right on. That's all I need to say. Seriously.
It's coming. It's coming. Yes, and John, 3 mules are generally better than 2 unless they're trampling on each other.
Thank you, ladies, so much. It was an amazing ride with each of you. I love being among brilliant people, and each one of you has added so much to this week that we've been together here. I can't believe the work you're doing. I've just been looking each one of you up in your companies or your organizations, and I'm really impressed with the work that you're pushing us to do. So thank you, because we're a little bit behind the curve in Virginia. Where I'm living in Richmond, I was writing these notes, Bill, because I want to bring this to the city of Richmond. I want to bring this all back and say, we need to do some of this revisioning.
Well, Richmond is a monument.
Okay, thanks, Bill. That's all I want to say.
Okay, somebody back here was standing up.
No, thank you.
Ed?
Just wanted to acknowledge the systems, Anita, as you brought to bear. That's part of this problem, and that's where the solutions lie. It would be lost on me if I didn't ask or challenge the audience, even those that are still here, that if you didn't think that race has been part of the conversation since we got here, then you've missed the boat. The idea of where these issues lie within it, it's the systems and it's the racialization of these systems that have created the disparities that we see. And so if Virginia is for lovers, it should be for equity. It should be we are definitely a diverse state, right? And I say we, although I live in DC, but I'm still part of the community. And we're for this notion of bringing people together around common interests. I love how you mentioned this notion of how life shows up in this space, irrespective of your identity, your ethnicity. Quality of life issues should be a common human goal. And if they're not operating, if our systems aren't working for us, then how are we challenging our systems to be better? How are we challenging those that are moving our systems, that we either hire or appoint to be more intentional around making these systems more equitable, so they're more inclusive, so that we're all seeing an equal and just, not just state, but nation and world. I just so appreciate the conversations, appreciate the examples that we have learned over the past couple of days. But the other test is going to be for us is, what are we going to do with what we've learned and what we've heard? How are we going to better connect going forward?
I'm hoping to get to that, Ed.
Thank you.
Other questions or comments? Yes.
Heather Peeler with Act for Alexandria, and I'm also very inspired by the conversation today, and can't wait to go back to my community and have a conversation about well-being, and especially around that idea of collective well-being. But I would love to hear from the panel about how we can do that in a way that doesn't perpetuate some of the, I guess, disappointing, frustrating aspects of the conversations that we've had around equity. So who gets to define well-being? How do we really foster a shared understanding of our collective well-being, and that my neighbor's well-being is important to my well-being? So if you could address that a little bit, how do we have these conversations in community?
Yeah. Tony, you want to go first this time? No. Go ahead.
This one's a hard one. I think part of it, from my perspective, is holding space for the conversation, bringing people together, not waiting for the answer to come, but creating that locally within your own community, I think is vital, because, from a national lens, every jurisdiction is different. And for example, in child welfare, we say, if you know one child welfare, jurisdiction, you know one child welfare jurisdiction. I think that goes to play among all of our communities here in Virginia as well. And I think then, it's only then that you can sort of dig in deeper to not be satisfied with the status quo, but to try new things. There is no answer to this yet. We don't have the answers. We know a lot of things, but there is a cost of innovation, and that cost of innovation is learning both what works and what doesn't work. And that goes to the fabric of your community and creating hope for all of those that live there.
Claire?
We have a grantee in Atlanta, and we talk about them like they're Atlanta, and they are doing well-being work, and it's really the first grant that we have in a community to do well-being work. And even though we say, well, it's Atlanta, it's actually 5 different cities in the Atlanta metro area, and they're primarily focusing on bringing together the Parks Department, the Fire and, Recs Commission, and different parts of the city to come together to talk about what Atlanta has like a wealth of community data available to them. And they're starting with a very targeted group of people and focusing on teaching them a little, giving them a little bit of background, talking to them about social determinants, talking to them about equity, hearing what they have to say. So I think starting at the beginning and starting small is really critical. I don't think you can start with everybody from a whole community because it's so personal, and different pieces of communities will have different interests and focus areas. And you have to develop, I think, trust among the people having these conversations so that nobody gets bulldozed. So I would just say we have to start at the beginning, and it's slow and it takes time and it's frustrating, but probably that's the best way to begin.
I'll say 2 quick things. One, I would think about who you're centering in the conversation, to Claire and Tony's excellent point, but that power shifting is critically important because your solution set starts from who you convene first and who you engage. So I think that's important. And as we continue to kind of pick away at the equity conversation, and I appreciate the gentleman's comment earlier, the careful facilitation of that conversation is critically important. And one thing to sort of remind folks, and that's why I sort of keep saying this, is equity has always been part of our choices and policies. Social Security is an equity-centered policy. Medicare and Medicaid is an equity-centered policy. The difference today is that we have long overlooked the conversation about race. And so one of the things that you're gonna have to be careful, like through the process, is not letting people off the hook on that piece of the equity conversation, but also reminding people that we've made choices from the beginning of time that's actually equity-centered. We just haven't centered necessarily all the people. So that's important.
Now, if I could add, growing up in Virginia, born in '56, I'm no longer a middle-aged white man whose life expectancy is declining. I'm past that.
Good for you.
But growing up, race clearly made a difference. You can't deny it in my mind, and it clearly has permeated so many things. Because I grew up with it. I'll be honest. I've had people say I'm colorblind. No, they're not. I mean, at least not where I grew up. So I hear what you're saying. What I'm trying to figure out is have the conversation that brings people in. And I think to the question, I think it's a lot of personal relationships. At the end of the day, moving the political world is personal relationships. And I heard a gentleman speak one time who said, when you're dealing with a politician, it takes 3 visits with them or 3 meetings to get their attention. The first time you go to some event, and they're good at smiling and shaking hands. And then the next time you go, because they're people, they're going to look at the date and say, who's that person? They were there before. But the third time you show up, they say, you're interested in them, and now you can have the conversation. So I think at the base level, it's getting and reaching to people that you wouldn't normally speak to. I think that division that we've created amongst ourselves of where we get our news, what we choose to do, where we choose to live does hurt. So I think being intentional about who you bring in and how you do it, and the ground rules for that conversation becomes really, really important. Somebody else? Yes.
Bill, kind of a comment question, but you might remember a little document called the Virginia Plan for Wellbeing.
Yes.
Yes, and it was that document that really was the catalyst for this network, for this convening, going back many, many years. So things have changed, children's cabinet, no children's cabinet, but is it time to dust off that Virginia Plan for Wellbeing? And I know folks are working on it, but I'm not sure that anybody here is really fully aware of it. And perhaps we do need to look at it with the right lens or prism, reflecting the current state of work when it comes to well-being and the narrative in particular, and centering the communities that we most need to center.
Right. Who here has heard of the Virginia Plan for Wellbeing? Okay, it's on the website, still the Department of Health website, but it was done by Dr. Levine and her crew on the McAuliffe administration. It was very thoughtful, looking at the things, and the theme of it is a tree with deep roots in the community, which I thought was really well done. I would encourage you to take a look at it, because one of the things that Robin has assigned us or assigned me to do, and I'm going to defer to them to do it, but is to give you all some homework. And the question here is, what do you do with what we've talked about today and over the last couple of days? What do you do individually, in your organizations, in your community, and then what do we think about as a network, if anything, fits for the network? Isn't that the assignment, Robin? Golly, I got it right. So, I think thinking about what we were talking about earlier, as it came, I think, a little bit to what is the story of your community is one thing to think about. Can you go home and work with people, Heather in Alexandria, you get that group together. What's the story of our community, and what is the story we want to tell? Not the one that's been told, but one that we want to tell. I think that's another way to do it. But I'd also look at this plan for well-being and tell us, does it apply to your community and what's missing? Because I think that does need, as we look at what this social compact is, and it's important. And what is the social compact between philanthropy and the people that we are trying to help becomes another question. But let's run back. Tony, tell them what to do.
I think a couple of key considerations include, as you're centering your conversations on data, not to include the stories that go along with it. So no data without stories. I think investing in partnerships, both the traditional partnerships and those of partnerships that are new or not as mature as some of your ongoing everyday partnerships, that connection that we talked about earlier. Prioritizing access and availability of sort of the factors of well-being in your communities. And lastly, I would say don't forget about a sustainable infrastructure, because it's the last thing that I feel like we should be wanting to do is to build something that can't sustain.
Claire.
I think I would recommend asking your community members what their vision is for the future. And I would really, really try, we're trying this at RWJF. It's really hard for us anyways, but defocus, unfocus, stop focusing on the elite voices, the elite institutions, the elite people, the researchers, the think tanks, like put all of those folks. I am a researcher, you are a think tank, like we work really closely together, but de-emphasize those voices and raise up community voices. So maybe not disinvite those other people from the table, but maybe like help them be a little more quiet. I think that's really critical.
Get the chairs right around the table, right? So not one has a big throne and the rest have small chairs. Yeah, we talk a lot about this three-legged stool with the foundation and their great work on culture of health, but I think it applies here. One is change the narrative of how you're talking about what you're doing and put it in kind of well-being language. You already have thriving, I think, something I saw on the signpost. You're a powerful voice, and a lot of social change happens as things start to catalyze and people start using different words and they start to emphasize things that we've talked about today around connection and purpose and that kind of thing. That matters. So the narrative matters, the community story matters, but also the narrative as you as philanthropists and what you're saying. The second thing, change what you measure. I wouldn't be a researcher if I didn't say this, but think about what you're measuring, whether through your grant making, your community impact, that is really speaking to well-being, as opposed to just the outputs of your grant making. And then relatedly, I think about those investment strategies. Go back and look at your own philanthropy, what you could be doing in coordination with other philanthropies in the state, which this conference has been a great expression of, and how you're pushing in your role for some of those systemic changes. Yes, you're not government, but you have our critical voice that pushes a lot of government conversations, and more so now than ever. I think philanthropy is having a stronger role as policy influencers, and so don't shy away from some of these systemic conversations as well. So those would be my three.
And with that, please thank the panelists. And Robin's back to close it up. Send them all home.
Please join me one more time in thanking Bill and our fabulous panel. We've had a great 2 days, and it was a pleasure to have you all here yesterday and today. We are wrapping up now. I just want to remind you, there will be resources on our website probably starting next week, very soon, including resources from Wellbeing from this panel will be on our website for Virginia Funders Network. Please fill out the evaluation form. We're not going to open the doors until you do. Seriously, please fill it out. Leave it on the table. We'll collect it. We hope to see you, if you would bring up the slide, May 7th and 8th, 2024, in some determined location, which we will let you know about in the very near future. It's been a pleasure to be with you. And please join me again in thanking all the people who were responsible for this terrific last 2 days. Safe travels.